Hi there. I am Sarah Morgan. Happy to be talking to you right now. I am the executive director of the Oakland Better Birth Foundation, Nia Healing Center for Birth and Family Life, Shift for Circle Community Doula Program, and the Better Birth Association of Harlem, New York. I wanted to make this video first and foremost to give a big thank you to the governor of the state of New York, Andrew Cuomo, who put forth a statement, a directive from his office to recognize that in the state of New York, a birthing person needs to be able to have support in the postpartum part of the recovery of after having given birth to a child. At first, there was some decisions on the part of certain hospitals in New York to deny the birthing person even their partner with them when it was time to have a baby. And the doula was dismissed offhand as not being essential to the birth process. There was definitely some pushback, and I'm really happy and excited about that. And then dads and partners were able to step back into their appropriate role as support person to their birthing spouse or birthing partner. And that's beautiful. But then the family was still denied the life-giving, soul-enriching process of having their doula at their side when they gave birth. That all ended yesterday, and that's beautiful. So doulas can now not only provide important prenatal information for their clients, but also be with them in the hospital room and support them through the birth of their children. I am so sure that doulas have no problem wearing the appropriate protective equipment and doing whatever is reasonable to ensure their own health as well as the health of people around them. And it's just really an amazing thing. It shouldn't be an amazing thing, but I'm grateful that the state of New York recognizes and that doulas are essential part of the healthcare team taking care of our pregnant citizens. Okay, so I live in California. It's not like that here. In California, we're only allowed one person with the birthing person in the labor room in pretty much all the hospitals. There are uh, a few exclusions to that, but for the most part, most of the hospitals have been lockstep, only one person. And so we're still working on that issue. And I wanted to make this video with some furthering that conversation and giving some suggestions to our citizens, our birthing and non-birthing citizens, as to what they can do to change this. The benefits of doulas is already well documented, scientifically proven. Less amount of time in the hospital if you have a doula by your side when you're having your child. Less need for medication, less operative deliveries, greater satisfaction, less trauma for the birthing person and the infant, and the doula tracking the family, especially during that first year where the issue of infant mortality is really great, especially in Black and brown communities and in indigenous communities, is imperative. All American women should have a doula at their side if they're birthing in a hospital, and particularly communities of color, African American, indigenous folk need to have that additional support going through a system which unfortunately has not caught up to the needs of this population. And the simple fixes that are required to help them birth successfully in their institutions. If those same folks were having home births, we would be having a different conversation. But we're not. We're talking about the majority of our community, because of the way insurance is set up, whether there are home birth midwives available in certain communities. That's the problem. That's a big problem for the United States of America, that we do not have enough We do not have enough nurse midwives in our hospital, and we certainly do not have enough home birth midwives across the country. And in that pool, we don't have enough midwives of color. We need to correct those issues. Those are gaping holes in the care that is being offered to women birthing in this country. So, in the meantime, right now, if you're in a state like California and it's only allowing one person in with the birthing person, what can you do? Okay. And I really want folks to take a nice deep breath. Sometimes, especially around medical people, there is this tremendous deference given. And when they tell us that we got to do something for some reason, we kind of feel like we got to do it. And so I just would like to remind us all that we are in charge of ourselves at all times. We're thinking, feeling, intelligent beings, just as the doctors and the nurses are thinking, feeling, intelligent beings. We can converse with each other. We can negotiate. We can work things out. And in the case of a person that is coming into a healthcare facility and you're using your insurance, private or public insurance, to pay, and some of us who are paying premiums towards their health care, you are a consumer, and you are paying money that helps to fund the big shiny hospital that you are birthing your child in. So just hold that in your heart. Like when you walk into that hospital, your tax dollars, your deductions from your payroll, the deductions from your checking account directly, however that happens, you are paying for everything that you see is going on in that hospital. Yep. And we don't want to be arrogant about that, but we do want to be realistic about that. And when we come into an institution and we're receiving a service, we have the right to have certain things to our liking, as long as they are medically appropriate, especially we're talking about medical care, right? Pregnant people overall are healthy people. They're coming into the institution to do a healthy event. And again, like I said earlier, the value of a doula is already documented. We don't have to go over that. So you're coming in to do this healthy event, and you are requesting the assistance of the medical staff and your doula to help you do this thing. So if the medical institution is telling you that you can't bring your doula in, you get to ask, well, why is that? Why, with all of the good data that supports the care of a doula for me and my baby and my partner and my community, why would I not be allowed to have my doula with me? And they're going to talk to you about the virus and yes, that's all really very important, and doulas are healthcare workers, like the doctors, like the nurses. They are medical healthcare workers, but we are we are healthcare workers. Doulas don't do medicine, but they do healthcare, physical hands-on support, emotional support, spiritual support, all of these things that are incredibly helpful when you're trying to push a baby out of your body. Incredibly helpful, right? And so doulas are coming in to do that. And so in the perfect world, the doulas would be considered part of the healthcare team, coming in to help the hospital have good numbers and good outcomes for the births that are happening in their hospitals. Much less medication, much less operative delivery. And also, because of COVID-19, we want to move families through the medical system as quickly as possible, since unfortunately in this country we have put our pregnant people in the same hospital as sick people. Other countries don't do that. Other countries have maternity hospitals where there's only people going to have babies and people having to deal with issues of reproduction and folks with That's all that's happening in that hospital. And so we don't have people who are going in to be treated for COVID directly going into the maternity hospital, say in Great Britain, right? So that's a problem, and that's a huge problem. Not a problem of the pregnant person's making. We didn't make that decision. It's not the problem of the doula. Okay, there may be certain doulas who feel that they can't work right now. Maybe they're taking care of an elderly mother, or maybe they themselves have underlying health condition, which makes it wise for them to not go into the hospital. But as far as doulas as a profession, it should be a slam dunk that we want these people to be in the hospital, helping families come into the hospital safely, at not at 3 centimeters, helping families through that important and very intense time of transition, getting folks comfortable, loved up, and ready to push out their babies is swiftly as humanly possible without rushing them, without pushing them, and without medical attention that they don't need. Right? We help make things easier for the nurses. We are there helping with all the non-medical needs of a pregnant person so that the nurse is free to take care of other patients who might be in need of their medical care. What are non-medical needs? Helping someone to get into the shower, changing their position in their bed, walking with them in the halls, giving them the double hip squeeze for hours at a time, because that's what this mama needs to be able to work with her contractions. The most wonderful nurse in the world does not have time to stand there doing that for hours. Nor should she. She went to nursing school to do other wonderful things, And so you get to talk to your hospital administration and say, these are all the good benefits of a doula, and I don't understand why you're telling me that I can't bring a doula with me for my birth. I don't get that. And I object. I protest. Do I need to write a letter? Write a letter. What do you need to do? Do that. So it's documented that you, as a consumer of, say, Kaiser here in San Francisco, you're a Kaiser member and you protest the fact that doulas cannot support me and other pregnant people when we come into your facility to have a baby. That matters. They need to see that. Okay? What you can also do wherever you live is to call your governor. Talk to his offices. If you don't know the number for your governor's office, Google will help you. I'm sure there is a .gov, www something.gov, that will help you get to your governor's office. And you can issue a complaint there. It's stating, these are all the benefits that I am aware of having a doula with me at my birth. My hospital, and it seems the other hospitals around me, are not allowing doulas. I protest this. It seems contrary to good health care. And, could you please consider doing what the governor in New York State has done, which is to issue an order saying and confirming that doulas are essential workers and should be allowed to be with the birthing person when it's time to give birth. Not doula or partner, but doula and partner. Okay? You can give a call to your mayor's office. Same thing. All this information is available to you. The quick Google search, finding your mayor's office, finding who the liaison person would be that you would speak to. I don't know. Maybe if you live in a small community, you can actually call your mayor and actually talk to that person on the phone. If you live in a big city like Oakland or New York, you probably might not be able to, but be able to speak to an aide or somebody with whom you can register this concern and this complaint. You're about to have a baby. The hospitals around you have this policy. Can you issue some sort of statement, look into this, and change it? It is not science-based care, and could potentially put certain people's lives at risk in not having a doula present. There are incidences of obstetrical abuse, unfortunately. There are medical people who are not being professional. And so having a doula's presence there, again, all well documented to help avoid that sort of thing, to help clients speak up to the medical staff and to remind that client that they are in charge of themselves at all times. That is guaranteed to us by the Constitution. Even if you're having a baby in a hospital, especially if you're having a baby in a hospital, you have the right to be heard. You have the right to have things clearly explained to you. You have the right to feel respected and to actually be respected in your questions and your choices. You have the right to not have medical procedures pushed upon you. You have the right to be given all of your choices, and then, unless it's a dire emergency, you have the right to make choices. I think even if in a dire emergency, you have the right to make choices regarding your health care if you're conscious and able to do so. That's it. Okay. Also, in certain communities, it would be good to get in touch with your Department of Health or the health officer for your community. Same thing. Get hold of that person, give them all the positives about doulas, let them know they may or may not know that the hospitals in the community are not allowing doulas to serve clients at this time. Stress upon them the importance of a doula being present, especially during a pandemic. And request some sort of intervention from their office along these lines. Get people talking. I know they're very busy. They've got a lot of stuff going on. This is a thing, unfortunately, women's healthcare needs, birthing people's healthcare needs fall to the bottom of the barrel sometimes when these things are being discussed. It's very perplexing to me, but that's what seems to happen. So we need to raise our voices up. We need to be heard and make sure that the needs of our future generation and the people who are bringing our future generation in is not lost in the shuffle of folks running around trying to do their job. Okay? What else can families do to help themselves have the best experience of giving birth under these circumstances or any circumstance? Definitely, please take a childbirth education class. Please take your childbirth education class from an independent childbirth educator. I say this for the simple reason that when you are going into the hospital and you're taking their childbirth education class, excuse my itchy, when you're going into this institution and you're taking their class, you're going to get their point of view, their world view about your body and your baby and your circumstance. Some childbirth educators in the hospital are wonderful. Many of them. I know them, and they're great people. And there are limits sometimes in what they can talk about, discuss, debate with the persons that they're teaching in the hospital environment. You want to go to somebody who's not beholden to the hospital in any way, with whom you can sit down and discuss all the ins and outs and ups and downs and have what's called complete informed consent about the process of having a baby in the hospital. The good, the bad, the happy, the not happy. And then you're able to make the decisions around what you want to do for your body, help create your birth plan with your doula that shows, that process helps really open you up. You want to make sure you do appropriate reading, just like any other big life journey, any other big rite of passage. You don't want to just go into it cold. Okay? You want to look at all sides. Very often the hospitals are giving childbirth ed classes for free, and that's great. Go on and take them. I think that's great. But then take a class with an independent childbirth educator. You might have to pay for that. Talk to the independent childbirth educator and see if they can offer you a sliding scale. All of the trainings and all of the work offered by us here at the Oakland Better Birth Foundation is for sliding scale and free to people who need it free. Independent childbirth educators, of course, they're trying to earn a living. I do know that most childbirth educators will have at least a spot or two for families who need to attend their class and who don't have the money. Talk to them about sliding scale. And it's important to compare that information from the independent childbirth educator to the information that you got from the hospital, and see how they dovetail or see how they diverge. Very important stuff. Be very well read. And what I can do is offer with this video a reading list of books that I think are super, super helpful, and I will do that. And you want to read, I'm going to offer you books that are like written by midwives and have a really high opinion of birth and really high opinion of the fact that healthy pregnant people can do this very, very successfully. We don't want to read any books that give us fear. You want to read books that help you eat super well and talk to you exactly about what that means, and talking to you about having the beautiful positive mindset, and books that thank you for giving birth, and books that lift you up. If you can't afford to take a class, reading the right books is crucial. And I will give you a brief suggestion of the books that I think are super crucial to read when you're expecting a baby. So you'll be able to see that at the bottom of this video once I pull it all together. Please, please, please hire a doula. Please, please, please hire a doula. What did I say? Please, please, please hire a doula. If you, again, the Oakland Better Birth Foundation can help you find a doula, can give you doulas through our Shift for Circle Community Doula Program. We will help all families regardless of their ability to pay. I know other doulas mostly will have sliding scale. Independent doulas are independent business people, and so they're feeling the crunch like you are. Make your best offer, and if it doesn't work with that doula, call the next one. Be persistent for your health. Be persistent for the care that you deserve for you and your beautiful child. Okay? Don't let money stand in your way. If you don't ask, you don't get. I've been amazed throughout my life what I've been able to achieve for myself and my kids because I took a deep breath and asked for help. Okay? Instead of a baby shower with a whole bunch of plastic stuff that you're probably not even going to use, have everybody chip in to help you pay for a doula. We're presently right now helping one of our moms and birth workers in our community to crowdsource for her home birth. And that leads us into, please consider home birth. Please consider birth center birth. Depending upon the state you live in, your insurance might even cover you having a home birth. Take a look at that. Find out that. Independent birthing center, again, we're talking about a center that's run by midwives. It is not the labor and delivery unit of the hospital. It is a separate, standalone center run by midwives who, again, have a certain mindset around birth that it is natural, and that with the appropriate prenatal care and attendance, that most women are able to birth their baby successfully. Okay, so again, those home birth, birth center birth, you want to take a look and see if your insurance will help pay for some of that. Some states it might be possible. Most midwives will work out a payment plan with you. Some midwives can afford to do sliding scale. Again, same with doulas. Talk to a few folks and see what you can do. Be a good, make a good bargain for you and your baby and your family and your future health. It's worth it. You're worth it. You are so, so, so worth it. Try to not let anything stop you with regard to that. And again, you'll have, at the bottom of this video, you'll have my number at Oakland Better Birth Foundation. If I can help you work through any of this anywhere in the country, so definitely my Bay Area peeps, definitely my Oakland peeps. But if you get the hold of this video and you have questions and you need help, drop me an email at Oakland Better Birth Foundation at gmail.com. give a call to 510-827-9160. Leave a message for me or text me on that number, and I will get back to you as soon as I can, or I will have one of my assistants get back to you with the answers to your questions. Okay? I want to give a little word about free birth, and I'm mentioning that because it is coming up, and it's come up in the doula groups and the mommy groups that I'm in on Facebook. I got to say that for myself, I don't feel comfortable with the whole free birthing scenario. But what I do feel powerfully comfortable with is people making their best and most solid decisions with regard to their bodies. That is the crux of reproductive rights, that women and birthing people have the opportunity to know that they're in charge of themselves at all times. They have every right to take full responsibility for themselves and their lives and make solid decisions for themselves and their lives and their bodies, and where they'll have their babies and who will be with them when they have their babies. So I hope I'm clear about that. And that being said, I want to offer that if you're going to be doing a free birth, please, please, please make sure that you are as educated as possible. Make sure that you do take a childbirth education class. Make sure that you do all manner of reading, the basic childbirth education kind of reading, as well as midwifery textbook. I would definitely recommend a wonderful book like Heart and Hands by Elizabeth Davis, which is a very good and basic midwifery text to take a look at, and talk to midwives, talk to doulas, ask them questions, and to make sure that you have a PhD knowledge of this process, that you are being very powerful and very brave and saying that I am willing to take full responsibility for this process in my body and my baby and my family. Yeah, and do that, and know that you definitely have all of my support in doing that. Your body, your baby. Okay. Same thing with folks who are considering home birth. Please don't choose home birth because you're scared of the situation that's going on right now with COVID. Please don't choose home birth because you're running from something. Go to home birth because you want to embrace something. You want to embrace a more holistic vision of bringing your child into the world. You're willing to work with a midwife as a peer. The two of you, you are hiring your team. You are teaming up and getting your professionals around you with whom you will have educated discussions and be educated. You'll educate the midwife will educate you, and you'll make the choices necessary for you and your baby. The midwife is not ever going to tell you what to do. The midwife, though, will give you all of your options, and it will be your choice. No? The statistics on having a home birth are very, very good. It takes a positive Google searches to see that. So have no fear. Take a deep breath, and do your negotiations. Find a midwife that you feel comfortable with. Don't settle for somebody who you feel kind of iffy about. Find somebody that feels comfortable to you, that you can work with, who's listening to you, who you can say anything to, who you can cry in front of. All of those things are incredibly, incredibly important. Does that person have time? Does that person listen? Does that person care? Make eye contact with you. All of those things are incredibly important. So don't feel like you're taking up too much of somebody's time. Don't feel like you're a burden or a bother. You and your baby are worth every good care. Okay? So that's all I wanted to say to you this evening. These are trying times, but we're getting through it. Bit by bit, we're getting through it. And I want to give my love to you and your loved ones. I hope that everyone stays safe and well and healthy. And again, if there's anything that either myself or Oakland Better Birth Foundation can do, please feel free to send an email to oaklandbetterbirthfoundation@gmail.com. Visit us online at www.nia, oaklandbetterbirthfoundation.com. That's www.nia, oaklandbetterbirthfoundation.com. Give a call to 510-827-9160, or you can text 510-827-9160. I love you. I send you every good wish for every good thing. I send you every blessing for the most beautiful and robustly excellent pregnancy, a gorgeous and powerful labor and delivery, and a sweet, precious newborn to love and cherish for the rest of your lives. Be well.